All right, welcome back, PGDMLT students. Today's explainer is going to track the journey of a blood specimen, literally from the patient's arm all the way to the centrifuge. We're zeroing in on one absolutely crucial thing, preventing pre-analytical errors. Because at the end of the day, your technique is what actually defines the patient's diagnosis.
Now, really quick, a mandatory disclaimer before we dive in. While we're going over the gold standard principles for venipuncture today, this explainer is meant to supplement, but absolutely does not replace your supervised hands-on clinical training. You still got to put in the practical work.
Okay, so quality control. It actually starts with strict patient identification way before a needle even touches the skin. And we've got to control physiological variables too. Things like heavy physical exercise, acute psychological stress, or maybe unapproved dietary or water intake. Those can completely skew baseline results. And here's a huge one. Leaving that tourniquet on for more than a single minute triggers hemoconcentration. That's going to seriously mess with the integrity of your test. When it comes to site selection, you have to be strategic. You're looking at the antecubital fossa, and your absolute gold standard here is the median cubital vein. Now, you really want to exercise extreme caution and steer clear of the basilic vein. Why? Because it sits dangerously close to the brachial artery and the median nerve, and you definitely don't want to hit either of those. All right, for the actual draw, strict aseptic protocol is the name of the game. You're going to clean that site with 2% chlorhexidine for 30 seconds. And then, this is key, let it air dry for another 30 seconds. Anchor the vein, but do not repalpate the area you just disinfected. No going back and touching it. Then, go in swiftly at an angle of 30 degrees or less. And remember, always release that tourniquet before you even think about withdrawing the needle. While you're collecting, you've got to maintain a really steady hand. Any rough jostling can mechanically lyse the red blood cells, which totally skews things like potassium levels. And post-draw, listen carefully. Never, ever manually recap or try to disassemble the needle. You're going to take that entire unit and discard it immediately into a puncture-resistant sharps container to keep yourself safe. So what happens when you're collecting multiple samples? Well, the order of draw is 100% non-negotiable. This is how we prevent additive carryover. You start with blood cultures, then you move to citrate, serum, heparin, EDTA, and finally your fluoride tubes. And once they're drawn, ensure immediate and accurate labeling right there at the patient's bedside. Don't walk away to do it. After you've gently inverted the tubes to mix the additives, you need rapid transport to the lab. Now, to process routine clotting assays, you're going to spin those samples at over 1700 G for 10 minutes. But here's the catch. You must use a room temperature centrifuge. If you use a refrigerated one, it causes cold-induced activation, which falsely shortens your clotting times, and we definitely don't want that. It's crazy to think about, but the vast majority of all laboratory errors happen right here in the pre-analytical phase. The whole diagnostic process rests completely on the integrity of your draw, your labeling, and your transport. So every single time you approach a patient, I want you to ask yourself, is your venipuncture technique going to protect their diagnosis, or is it going to compromise it?